Good evening and welcome to our presentation on A.S.I.A. When I say Asia, we're not referring to the continent, but to a medical condition that is an autoimmune and inflammatory syndrome that's induced by adjuvants. And we'll explain what that means in this discussion. It's also referred to as Schoenfield syndrome. One of the principal investigators and researchers, Dr. Schoenfield, actually is very important in discovering this condition. And tonight, Roxanne Altman is one of our nurse practitioners at our center, and she will be joining us for this discussion as well. Okay, the definition of this autoimmune disorder is an autoimmune inflammatory syndrome induced by adjuvants, and we'll discuss and define those in a minute. It's also known as Schoenfield syndrome. It encompasses several autoimmune conditions or phenomena that are induced following exposure to substances with adjuvant activity. So it's not necessarily just all things that are related to immunizations. As you'll find out, there are other things that can contribute to this. Adjuvants are included in vaccination formulations for their immunogenic properties. They enhance the immunization process. Despite generally being well tolerated and safe, according to the CDC and the FDA, some folks that are genetically predisposed can develop a sort of generalized, nonspecific constitutional symptoms, autoantibody production, and new onset or worsening of their existing disease presentation.
So this is the biopolymer, and this can happen if you have a previous autoimmune disease, if you have a familial autoimmunity. Sometimes people can have a history of previous toxic exposure based on the different types of substances and which part of the body was affected by the injection.
Right. So A.S.I.A. syndrome actually can be a syndrome other than just injections. For instance, silicanosis or other substances like mineral oil that sometimes people will inject into themselves for cosmetic reasons, or like the silicone we see in implants, like knee replacements and hip replacements. And of course, the elephant in the room is breast augmentation, where you have silicone implants. And sometimes the silicone can act as an adjuvant and can lead to what they call BII, or breast implant illness. Other things associated are sick building syndrome, where you have molds and other agents and chemicals in a building, whether it's your home or your office, that can cause this syndrome. Gulf War syndrome is another one that seems to spark this kind of reaction. And post-vaccine syndromes, that's kind of the focus on our discussion this evening. And then there's something called macrophagic myofasciitis syndrome, or MMF, and that's a localized reaction in the tissue where the immunizations have been administered. So if a shot is administered in the shoulder, let's say, you'll have a localized reaction there due to the accumulation of, let's say, aluminum, and it infiltrates into the macrophages at the tissue site and can cause a localized reaction.
So when the body's exposed to external stimuli, whether it's infection, vaccine, silicone, adjuvant, prior to clinical manifestations, some of the typical things that are seen can be myalgia, muscle weakness, joint pains similar to arthritis, chronic fatigue, feeling like you're not getting sleep throughout the night, or waking up not feeling like you got enough sleep when you do wake up, neurological manifestations associated with demyelination, cognitive impairment, brain fog, memory loss, and then things such as pyrexia and dry mouth.
Yeah, so pyrexia or fever, yeah. Go ahead, Roxanne.
When you remove some of these, toxic agents, sometimes you can see symptom improvements. You can also do a biopsy for the involved organs to identify the cause.
And then
the minor criteria can be some of the appearance of the autoantibodies directed at the suspected adjuvant. Other clinical manifestations can be like irritable bowel syndrome and specific HLA, DRB1, and HLA-DQB1, and the involvement of an autoimmune disease such as multiple sclerosis or systemic
sclerosis.
SC.
Yeah, so SSC is systemic sclerosis, which can affect multiple organs, liver, lungs, heart, that sort of thing. So on this slide, I just included this because this is kind of some of the more typical popular autoimmune disorders, and this actually compares some of them by gender. So there are some that are gender specific, like the females are represented in sort of this red category and the males in blue. And you have Sjogren's syndrome there on the far left, which is predominantly female. Only few males are affected when you compare them. Same thing with systemic lupus or SLE. And thyroid disease, we know already, that's a common one that's more gender specific. On the other end, you have things like diabetes mellitus and ulcerative colitis, which are more equal in nature between males and females.
So some research studies from 2017 shows concern. From 2011 to 2016, one study identified 4,479 A.S.I.A cases. Of them, 305 fulfilled arbitrary criteria of severe A.S.I.A and 11 deaths. The majority of severe A.S.I.A cases were related to HPV vaccine, silicone, influenza vaccine, and mineral oil injections. The interval from exposition to severe manifestation was from 2 days to 23 years. Severe A.S.I.A may be observed after influenza, flu vaccines, and other vaccines such as the HPV vaccine. Efforts should be made to discover the connection between the adjuvants, autoimmunity, and autoimmune diseases, because there is an increase in cases severe and life-threatening of A.S.I.A. And speaking of the HPV vaccine, they did use the aluminum for the placebo when they were doing the clinical trials. And they used a different type of aluminum that had not been fully researched. So it was sort of an ethical issue. And the other concern was that when studied globally, the rate of cancer after the vaccination increased was much higher. So then Merck was able to create a catch-up vaccination program, which enabled people older than the original age group. So now people that are male or female, beginning at age 9 all the way up through 45, can now receive the HPV vaccine, even with all the controversy that's behind it. There's been several trials that had numerous exclusion criteria. No one was allowed to participate in the trials that had severe allergies, prior abnormal Pap test results, over 4 lifetime sex partners, a history of immunological disorders, and other chronic illnesses, reaction to previous vaccine ingredients, including aluminum, yeast, and benzonates, or a history of drug or alcohol abuse. Yet Merck now recommends Gardasil for all of these groups, which is pretty scary. And again, the placebo was using aluminum. And all the people that were participating in the trial, if they had an allergy to it, they were not even allowed to participate in it. So it just doesn't really get shared when you're being told that it's safe and effective, just get the vaccine. So half of the study participants reported serious adverse events within 7 months after getting the HPV vaccine, and they were just classified as new medical conditions. So again, the cervical cancer risk-benefit ratio is just not worth it. According to the Gardasil package insert, women are 100 more times likely to suffer a severe event following a vaccination with Gardasil than they are to even get cervical cancer. And the other poor part about this is that women felt that they were going to be 100% covered from having cervical cancer, so they stopped getting their routine Pap smears, which is really what finds the majority of cervical cancer, because they felt that they were being protected from the vaccine. So we, have a couple issues there with, not having routine preventative care that has already been proven to work, with something that is only covering, a few certain strains that's been the worst as far as vaccine adverse reactions, and one of the, the history of vaccines.
Okay. Thank you for that, Roxanne. And on this slide, we see a research study from 2018 where 300 patients were analyzed. The average age of disease onset was around 37 years. So there was some issues with duration of time latency between adjuvant stimuli and development of the autoimmune condition, and that was about 16.8 months. And it ranged anywhere from 3 days to 5 years. So it's not necessarily an immediate thing for some. It can be dragged out for years. Arthralgias, bony pain, joint pain, myalgias, muscle pain, and chronic fatigue were the most frequently reported symptoms in this study. 89% of the patients were also diagnosed with other defined rheumatic or autoimmune conditions. The most frequent autoimmune disease related to A.S.I.A is an undifferentiated connective tissue disease, or something called UCTD. It is also one that will give you a positive ANA, or anti-nuclear antibody test. Clinical and laboratory features differ from different types of adjuvants that are used. These findings may contribute to an increased awareness of A.S.I.A syndrome and help physicians to identify patients at a greater risk of autoimmune diseases following exposure to vaccines and other adjuvants. The A.S.I.A Syndrome Registry provides a useful tool to systematize this rare condition. I think this rare condition is going to be more common in future years as we live in a more polluted environment, both with the increased number of vaccines on the CDC schedule, as well as certain adjuvants that are in our environment. So I think A.S.I.A may be a little bit obscure now, but in a few years I think it'll be something that's going to be top of mind for a lot of patients and hopefully their practitioners and physicians that take care of them so they can identify this. Hopefully the reporting to the CDC through these registries are being utilized. All right, one more report, a paper that was published in a peer-reviewed journal. And again, on each of these slides, I have placed the reference at the bottom from the PubMed, the NIH reference. In case anyone wants to look at these in greater detail, they can look up these studies. But this is from a 2020 paper, so it's very recent. Chronic fatigue syndrome, what we call POTS, P-O-T-S, which is postural orthostatic tachycardia syndrome. That's where you have a lot of low blood pressure with reactionary tachycardia, and we see this in a lot of conditions. Like in Lyme disease, you see a lot of patients with POTS. Complex regional pain syndrome, which is a kind of a fancy term for like a chronic pain syndrome. And then you see also silicone implant incompatibility syndrome. Now that's a newer term. We usually refer to that as BII, or breast implant illness, but I guess silicone implant incompatibility would refer to other things where silicone is used, such as joint replacements and such. So it's not just limited to breast implants. So this was a subject of some debate with clinicians and researchers. Both the pathogenesis and the treatment of these disorders require further study. Again, we're just scratching the surface with this. And in this particular paper, they summarize the evidence regarding the role of autoimmunity in these 4 syndromes, and in respect to their immunogenicity, autoimmune comorbidities, alteration of the immune cell subsets, and that produce autoantibodies, both in animal models. So these syndromes could be incorporated into sort of a new concept of autoimmune neurosensory dysautonomia, and that's kind of the common denominator, is something what they refer to as the G protein coupling receptor, or the GPCRS, which are in eukaryotic cells. So a eukaryotic cell is one that has a nucleus, has membranes around the nuclear material, as opposed to prokaryotic, which don't have a encapsulated nucleus. Those are like bacteria and more primitive forms of cells. So eukaryotic cells have this membrane, and these receptors, these G protein receptors, are actually like inboxes. They allow messengers in to the cell, and they're like light energy, peptides, the lipids, and proteins, basically hormones. And then also small fiber neuropathy. So this is a condition usually happening in the skin. It's kind of a sensory thing where the small fibers of the peripheral nervous system are affected and can lead to numbness or burning sensations. And then, of course, top on the list was Sjogren's, which is a classified autoimmune disease, usually associated with dry eyes and some other skin changes. It's a classic autoimmune disease, and this should be kind of what serves as the model for Asia and some of the things we're seeing there. Roxanne mentioned on the previous slide some reporting. You should report vaccine reactions, and she has a little bit of a story about what happened to her recently. Roxanne?
So I went to fill out a VAERS form to report an anaphylactic reaction to a vaccination that someone had received. And it took about 15 minutes. I had, the information, about which vaccine she received, around the date, I believe. You can leave some of that a little bit blank, but basically at the end of the whole form online, it had an error message. And so I sent an email to report this to see, did they still receive it? How else am I supposed to fill it out? Because I had a couple others that I needed to submit. And it took them about 14 days. And when they replied back, basically I could just fill out the paper form. Well, none of us have all this extra time floating around, which is why, the VAERS system's probably only reporting 1% of actual, issues. But it's just very frustrating to not have a better platform that can really, catch all of these things, because I think that, there would be a little bit, it would be a little bit easier for clinicians and patients to see, possible side effects, really look at their risk versus their, risk versus benefit. And, I think that it's frustrating enough to have to fill out that form and then to have it, malfunction. I think there just needs to be a better system where we can track these things and really kind of put together the pieces of what's causing some of these, autoimmune issues, and follow people a little bit farther along than some of the trials do.
Okay, this slide actually summarizes in a kind of more of a pictorial form some of the things that are associated with A.S.I.A syndrome. You've got the minor and major criteria listed here, as well as things like SIIS, which is the silicon implant incompatibility, sarcoidosis, Sjogren's syndrome, and UCTD, which is the connective tissue disorder, and some other things. So you can come back and pause this slide and look at this if you wish for more details. But we're going to move on.
So this is a list of several different adjuvants that are used in U.S. vaccines. You can also go to the CDC Pink Book, and it will list all of the different vaccinations and all of their ingredients, which is on the CDC website. They do update it periodically, so it is interesting to check it and make sure that there's not been any updates. But as you can see, there's a lot of vaccines that are still utilized with aluminum in those. And aluminum is considered a neurotoxin. It's inflammatory, and it interferes with several biomolecules and biochemical pathways. It disturbs calcium metabolism. It increases oxidative stress. It binds to phosphate groups, affects ATP, and competes with iron and magnesium. So there are a lot of issues with just aluminum in itself. And then as you can see, there's some other different adjuvants that are used in some of these other vaccines, including the Shingrix, the flu vaccine, and then some of the ones listed below don't have any adjuvants. But if you go to the CDC book, you may see some of these ingredients that you don't necessarily want in injected in you, much less even eating them. So even though it may not have an adjuvant, there's still other issues that you may find once you do a little bit more digging.
Right, just to add a little bit to this, so this slide, if you want to pause and review this, a lot of the things in the second column under vaccines, you see the vast number of vaccines that have aluminum as an adjuvant, and these are different types of aluminum salts, like aluminum hydroxide and phosphate, and potassium aluminum. But and then at the bottom you see several vaccines that do not have adjuvants, and you can add most of the known COVID vaccines to this list. There are, I think, right as of now, there are about 9 in production internationally, besides the major ones that are in the United States by Johnson & Johnson, Pfizer, Moderna, and AstraZeneca in Europe. The Chinese have one, the Japanese apparently have one, and Russia has the Sputnik vaccine, and one of those actually does contain an adjuvant, but we're not seeing that in the United States. But anyway, you should be aware of this. A lot of rebuttals are that, you know, if you cook with aluminum cookware in the kitchen, and if you use acidic sauces like a tomato sauce in an aluminum pan, that you are actually absorbing some of that aluminum from that, and that an injection would be no more than what you'd normally get out of a meal. And that's kind of a little crazy, because the you know, taking it orally may be quite different from injecting it directly into your tissue in a vaccine form. So I think it's kind of apples and oranges, and I don't like it when people make that reference comparing those as equal.
So these are some of the adjuvants again mentioned from the previous page. This is listed again on the CDC. Aluminum is really kind of downplayed as not so toxic. However, if you flip back to the previous slide, you can see that many of the vaccines that contain aluminum are on the children's vaccination schedule, with multiple series of the same, you know, vaccines that have aluminum in them. So that builds up over time, and, you know, there are consequences of that as well. And then there's AS.04, which this vaccine is actually no longer available in the United States. In 2018, there was a ban of this by the Indian Department of Health due to reports of all the side effects. Again, the MF59, which is in the influenza vaccine, oil and water component. So again, this is, you know, mentioned before on some of the slides, the effects that this can cause on people. And this is given, you know, to people, you know, all over, millions of doses every year. So the AS01B, this is a suspension used in the Shingrix vaccine. And the CpG 1018, this is something that's used in the hepatitis B vaccine.
Okay. I threw this slide up because it illustrates what happens with the immunizations and some of the cells that are involved, some of your Th17 cells and T and B cells that are involved in the process of A.S.I.A as it develops. But also I want to comment on aluminum. We do know there's a link between aluminum and dementia and Alzheimer's disease. So you know, we're really trying to limit our aluminum exposures, and it doesn't help when we're putting them in medications and also immunizations. So it is a heavy metal. It's not really found in any good healthy biological functions as a cofactor. So it's considered a heavy metal and toxic. You guys can pause this and take a deeper dive into the slide if you wish, but we're going to move on. This slide is the last slide in our presentation. It kind of wraps things up a little bit, but this illustrates how the environment, things like Epstein-Barr virus, silicone implants, even the newer coronavirus, the COVID-19 virus, as well as some genetic predispositions, the HLAs, and some other genetics that we probably haven't even discovered yet, along with some hormonal agents too, like your estrogens, progesterones, prolactin, can have an effect on overstimulation of our immune system. This develops obviously some autoantibodies, so antibodies that attack the self, that attack our own tissues, leading to, by definition, what is autoimmune disease. Now, when you have an autoimmune disease, you're higher risk for having a subsequent second or third one. And there are about 120 known named autoimmune diseases out there. And those, if you have them, will actually lead to an increased risk of cancer, especially lymphoma. So this has to be taken very seriously. And Roxanne has a few more comments about some things.
Well, as you can see on this slide, environmental factors, the things that we put in our foods, the chemicals that are used, in the farms, along with hormones, from the cows and the, animals being injected with hormones, along with the uptick in the vaccination schedule. We didn't see a lot of these issues, 30 and 50 years ago with allergies, skin issues, autoimmune disorders. So there is, a correlation here of all of these things that have changed in the last 30 and 50 years that we're now seeing, the consequences of, our environment, the hormones that are being used, the uptick in vaccinations, the adjuvants used, breast implants, knee replacements, all of these things that, weren't necessarily utilized as much before. Now we're seeing the uptick of all of that, and now all of the autoimmune conditions are following, unfortunately.
And this is the final reference slide. So there are some references listed for those that are interested in the evidence-based medicine aspect of things. So here you go. There's several listed here from peer-reviewed journals. And the last one actually looks at the new SARS-CoV-2 vaccine and the SARS infection actually that can also trigger autoimmunity. So that's something we're going to have to deal with from now and probably the next decade as we see this evolve. But Roxanne and I thank you very much for joining us for this presentation. And again, it'll be archived. You can review it again and pause it to take a longer look at some of these slides.